Ceann Comhairle, as I stand in this House for the first time as Minister for Health, I am deeply conscious of the impact of COVID-19 on the people living in our country. We have seen our safe, well-ordered worlds of routine turned upside down. We have lost beloved friends, families and neighbours and been unable to mourn them as we want to. We have asked more and more of the people working on the front lines and behind the scenes in our health service, asked them to work relentlessly in the face of what must have seemed like endless days and nights. Ceann Comhairle, I would like to thank every one of them from the bottom of my heart for all that they have done. And I know that the people they work so hard to care for do too. I thank our radiographers and our porters, our healthcare assistants and our midwives, our doctors, our ambulance personnel, our receptionists, our nurses, and the 100 other professions that have cared for patients and kept our hospitals and other health facilities running so well in the face of this awful disease. We need to repay their hard work and that of many others outside the health service by continuing to listen to the public health advice. This disease has not gone away. It is highly infectious, and we have many people in our society who are especially vulnerable to it. As we heard last night from Siobhan Killeen of the Dublin GAA team, even people who are fit and healthy can become very ill. We know that even after people have recovered from infection, they can face weeks or months of after effects. We have to keep up the good work or risk losing the ground so many have fought so hard to gain. It is, of course, hugely important that we reopen society and our economy, but we cannot do it, Ceann Comhairle, at the risk of another wave of infection around the country. So I'm asking people to follow the advice of the experts who have guided us very well so far. We still need everyone to wash their hands well and often, maintain their physical distance from others, try to limit their contacts with others, observe cough and sneeze hygiene, and wear a face covering where physical distancing isn't possible. We need everyone to remember the symptoms of COVID-19 and contact a GP immediately if they feel sick. COVID-19 has affected every part of society here, including, of course, our finances and previously agreed budgets. I am seeking this afternoon the House's approval for this revised estimate for the 2020 vote for my department, vote 38, in order to ensure that the health service continues to be funded in 2020 to meet the significant and unprecedented challenges of COVID-19, and to ensure the funding of much-needed health and social care services to our people. The original revised estimates for Public Services 2020 was published in December of last year, with a total of 17.9 billion in exchequer expenditure for vote 38. Following this, the National Service Plan 2020 set out the totality of planned services for the year based on the December allocation, including additional provision to advance Sláinte Care objectives in 2020 and other key development priorities. The delivery of the plan for 2020 has been severely affected by COVID-19, as the health services responded in an unprecedented fashion to the pandemic and incurred substantial additional costs in so doing. As a result, the revised estimates presented today provide an additional €2 billion to health in 2020. This brings the new adjusted total for the health vote to €19.9 billion. Today's debate, Ceann Comhairle, has a very specific purpose. Approval of these estimates provides the legal basis for the increased expenditure being incurred by the health vote and will ensure that the health service is funded in the months ahead. The scale of expenditure to date and measures taken in response to COVID-19 and the overall impact of COVID-19 on the finances of the health system means that the passing of this revised estimate is essential to ensure compliance with the 4/5 expenditure rule. The figures presented to the House today represent the expenditure approved by the previous government for COVID-19 measures to date. It does not represent the totality of the cost of COVID-19 for this year, nor an estimate of same. Significant further investment will be required this year in areas such as personal protective equipment, acute bed capacity and planning for winter 2020. We will also have to continue to assess the impact of factors such as the potential increase in those qualifying for medical cards due to economic developments and potential reduction in private charge income to hospitals. Today's debate is also an opportunity to begin a new conversation about our health service and its funding. The pandemic response has highlighted many strengths and positives in our health service. However, we know that our health service is challenged in normal times and was not best positioned to deal with the pandemic. Poor access to primary and community services, capacity deficits in acute hospitals, in areas such as critical care, and weaknesses in the governance and integration of services were handicaps which the health service has moved rapidly to deal with as best as it could. We need to build upon this work and in doing so, ensure that the health system has the capacity and capability to meet future demand. We know for sure that future demand will be influenced by a growing and ageing population. But as recent months have proven, we must also be ready for unexpected public health threats. A stronger, more resilient health service is a national priority. The pandemic response has required the implementation of many of the key principles of Sláinte Care, a single-tier health system for COVID-19 patients, care provided at home or in the community instead of in hospital, and telemedicine, virtual consultations, e-prescribing and other e-health initiatives. The benefits of these principles have now been demonstrated, and we must apply these lessons across the system. Over the past number of months, there has been significant investment and enhancement in capacity and staffing across the health system. This too needs to be sustained, as major additional investment will continue to be required to increase the capacity of the public system to better meet the health needs of our citizens. As the reopening of our economy and society progresses, the many challenges that the health system faced before the pandemic still exist, but now must be tackled in a new and at times more challenging context. One of the most pressing tasks is to resume the operation of health and social care services in the face of a thankfully much reduced level of COVID-19 infection. This will involve on-the-ground assessment and changes in clinical practice to prevent and control infection. It will take some time to clarify what level of activity will be possible to achieve in each of these settings. While the HSE is working on a clinical roadmap for the delivery of non-COVID services in a COVID environment, it will be necessary to reassess the targets set out in the National Service Plan. Capacity in many services will remain reduced and demand is likely to be higher than normal, both because elective activity was postponed during the crisis and because demand for many services may be higher than pre-COVID levels. Meanwhile, we will need to be vigilant in implementing the public health surveillance and controls to avoid further spikes of COVID infections, while being prepared to deal with any upsurge in healthcare requirements if, as a country, we are not successful. The programme for government sets out the government's vision to address both the long-standing and new challenges, building upon the Sláinte Care vision and reflecting on the COVID-19 pandemic response. This government has set as its mission the introduction of universal healthcare. Key building blocks to achieve this include the delivery of more care in the community, increasing capacity in the community and in acute hospitals, with an immediate focus on critical care capacity, supporting our healthcare workforce and implementing e-health. The programme also makes specific provision for enhanced care for older people and provides for the establishment of a commission on care and supports for older people. The delivery of this programme will require major investment in the public health service through both current and capital expenditure. However, it will also require major reform. This reform will not just be about how we deliver health services, but also how we fund and invest in them. The programme for government identifies the need for generally improved budgeting for demographic-related costs, which is particularly relevant to the health services. Ministers will be required to produce service improvement and reform plans, as set out in the programme. Spending in health will be prioritised for improved budgeting. Returning to the revised estimates and the measures contained within. In support of the National Action Plan on COVID-19, €2 billion in additional gross expenditure has been approved to date for specific measures. This funding is incorporated in the revised estimates. Approximately €1.2 billion in additional cash has been advanced to the Health Service Executive to the end of June to meet the ongoing costs of managing the pandemic. As a result, my department estimates that based on current trends, the health vote will reach the ceiling under the 4/5 rule for expenditure by August. Hence this request to the House to endorse the revised estimate before it today, so as to resource measures to tackle COVID-19 and continue to deliver a broad range of health and social care services. I will now outline the key health measures delivered to date from the National Action Plan on COVID-19. Further detail has been provided to deputies in the briefing pack prepared by my department. First is testing and tracing. At the core of Ireland's COVID-19 response is a commitment to robust and continuing public health actions, including testing levels, contact tracing, modelling and surveillance to estimate the potential impact, communicating evolving public health messages and maintaining public awareness so that we can adapt our public health response as flexibly as we need to. The National Public Health Emergency Team has recommended that the Health Service needs to have a testing capacity of 100,000 tests per week for the remainder of 2020. The HSE has put this capacity in place, with 90% of all tests completed from end to end in 3 days or less. The plan includes support for nursing home and home support. The revision makes provision for the Temporary Assistance Payment Scheme, which provides support to the private and voluntary nursing homes to ensure they can continue their role in the overall public health response to COVID-19. The nursing home sector cares for one of the most precious and vulnerable groups in our society, and our goal is to protect our older people, wherever they are living. Priority actions included heightened infection control measures, supporting staff working in the nursing homes, and ensuring their safety and health as we continue to deal with the pandemic. In addition to financial support, the HSE is also providing substantial non-financial support in the form of PPE supplies, temporary accommodation for nursing home staff, and through the crisis response teams, including deployment of HSE staff. There is also considerable support in the form of telephone support, IPC support, and public health support provided to the nursing homes. Relating to enhanced GP services, revised arrangements with our GPs were established to ensure the people of Ireland had access to triage services for COVID-19, and I really would like to compliment our general practitioners and everyone who works in general practice on how they have responded. Dedicated COVID-related respiratory clinics were set up in GP practices. Telephone triage was set up in order to facilitate remote access to services in line with public health advice. The clinical management of patients with mild symptoms of COVID-19 was shifted from hospitals to home and community settings. These arrangements were for an initial period of 3 months. However, key measures have been extended until the 10th of August of this year. With regard to caring for people in acute services, the initial focus for acute hospital preparedness was on building up surge capacity to ensure the maximum possible number of critical care and general acute beds were available to cope with the potential number of cases requiring hospitalisation. Baseline permanent adult critical care capacity in Ireland was 255 beds. Funding for a further 40 adult critical care beds and 2 paediatric critical care beds was provided as part of the response. In addition to the funding for increased critical care capacity, the response to COVID funding for an additional 324 general acute beds. The acute hospital system and critical care services coped during this crisis. While bed occupancy reached 280 critical care beds at the peak, the additional demand for critical care was met by surge ICU capacity, and thank God we didn't see the scenes that some of our neighbours in Europe did with people needing very serious acute care in the car parks of hospitals. The HSE secured 100% of the capacity of the private hospitals for an initial period of 3 months. As of Monday, the 22nd of June, 11,531 public patients have been treated as inpatients, 46,298 as day cases, 44,865 as outpatients, and 71,967 public patients have been provided with diagnostics via the private hospital arrangements. The agreement concludes today, the 30th of June, and work is ongoing in relation to future arrangements with private hospitals. The National Action Plan provided for a significant expansion of the health workforce. The HSE pay budget has increased by €490 million in the revised estimates due to the projected increased salary, agency, overtime and absenteeism costs associated with the response to COVID. The number of whole-time equivalent staff in the HSE has grown by 3,271 this year to the end of May. My officials are now engaging with the HSE on staffing requirements for the remainder of the year to meet both COVID and non-COVID demand. As part of the response to COVID, there has been investment in the expansion of community care places, including those for persons with disabilities across the country. This includes advancement of projects planned in line with the Disability Decongregation Programme, as well as upgrade and refurbishment work on suitable facilities. In addition, arrangements were made for healthcare staff needing to self-isolate. These have largely been managed locally by the community healthcare offices of the HSE, centrally the main isolation facility established with City West. The HSE has decided to step down this arrangement and has triggered the break clause, and the agreement will conclude on the 22nd of October. A key focus throughout the pandemic has been the area of infection prevention and control. In a time of global shortages and intense competition for PPE, the HSE, with the support of my department, the IDA, the Department of Foreign Affairs and others, managed to rapidly develop global and domestic supplies of PPE. PPE will represent one of the biggest single items of expenditure associated with the COVID response. However, my department advises that HSE modelling has identified that the overall cost of PPE in 2020 could be as high as €1 billion, and my department and the HSE are engaging. The additional funding allocated to the Health Vote has allowed for a rapid and targeted response to implement the measures outlined in the National Action Plan. We remain in a pandemic, and the scale of the challenge for the health services is unprecedented. Further investment will be needed, such as additional PPE, as enhanced flu vaccination programme for the next winter, increased capacity and alternative arrangements with private hospitals. Such measures are under review by my department in collaboration with the Department of Public Expenditure and Reform, and Government will be asked to determine additional funding allocations where necessary. Also subject to further review and deliberation are the achievability of the National Service Plan savings, the loss of hospital income as a result of COVID-19, additional costs associated with recommencing non-COVID healthcare within an environment of physical distancing, and heightened infection control and additional initiatives for the winter. The health system responded quickly and efficiently to the COVID-19 emergency. Additional spending has facilitated necessary and rapid introduction of testing, provision of essential personal protective equipment, enhanced support to critical health services, and introduction of additional hospital capacity and community services. Existing oversight structures between the Department of Health, the Department of Public Expenditure and Reform and the HSE, including the Health Budget Oversight Group and the new structures and processes, have facilitated timely decision-making during the pandemic, while also ensuring high standards of governance are maintained. These structures ensure that these structures ensure that this significant investment is approved, monitored and reported in line with the agreed sanctioning processes and financial procedures. I commend the estimates for the health vote to the House. The revised estimate represents a very significant but essential investment in Ireland's pandemic response. Ireland has been successful in flattening the curve of coronavirus transmission. This pandemic has been an unprecedented challenge, met with great solidarity and fortitude by the people of Ireland. We're going to need that continuing sense of community and responsibility as we take our first steps into a reopened country, travel around Ireland and learn to live with COVID-19. We all need to use our own judgment and take personal responsibility for protecting not just ourselves, but those around us. I'm asking everyone to be aware of the risks and keep yourself informed about the disease and where it is in our community. Check our online COVID-19 data hub before you leave your house, like you do the weather. Keep a log of the people you meet so that public health officials can contact them if they need to. Cian Corla, we are not out of the woods yet, but if we stay the course, there will be a day when we are. Thank you.